Good morning. This is going to be my speech regarding mental illness, most specifically depression. My audience I have with me is my brother Tim and his girlfriend Tessa and my wife Stephanie, who's recording. And my fourth person had a family emergency and not able to get a fourth person, so we're going to make do with three today. At first, when I was going to do this speech, I wanted to do mental illness, and then I realized that it was probably a very vague topic to cover within a 5 to 7 minute time frame. So specifically, I wanted to concentrate solely on depression. Depression is something that maybe, as a few of you might know, is a very common illness. Personally, I have a family member that suffers with depression. My goal out of this speech is primarily to raise awareness of what depression is. That way it's a little more recognizable, and just kind of go over what's all involved with depression, treatment, symptoms, all that good stuff. As I said before, depression is one of the most common mental health issues according to the National Institute of Mental Health. Recent research suggests that depression is primarily made up of or results from 4 causes. It's a combination of genetics, biological, environmental, and psychological factors. They all play a part. It is defined as a common but serious mental disorder. It often affects how you think, how you feel, your ability to handle everyday activities such as sleep or eating. In order to be diagnosed as depression, the symptoms that I'm about to go over need to be present for at least 2 weeks before it's actually defined as or diagnosed as depression. Depression, real quick before we get started with the symptoms, it affects everyone involved. It's not just the individual dealing with the mental health issue. It affects friends, family, your work environment. It affects everybody that's involved. Depression can also lead to suicidal thoughts. Recent studies show that 1 in every 25 attempts is successful, and surprisingly, men are more prone to suicide than women. Women are more commonly known for suicidal thoughts rather than actually committing suicide. Men make up 79% of all suicide rates. Even children, 1 in 65,000 children between the ages of 10 and 14 commit suicide. And it is actually 2 times more, is the cause of 2 times more deaths a year than HIV or AIDS. There's many different types of depression. 5 of the most common types are persistent depressive disorder, which is a form of depression that lasts over a long period of time, 1 to 2 years, typically 2 years or longer. There is prenatal depression, which obviously women go through. It's a form of depression that occurs while you're being pregnant. Anything could happen, something goes wrong in an appointment and it causes depression. And there's another form of that, which is postpartum, which is obviously after birth. There's psychotic depression, which is depression followed up with some type of psychosis, which could mean like hallucinations. It could mean hearing and seeing things that other people are not able to see or hear, often accompanied by false feelings of guilt, worthlessness, or even poverty. There's another form, seasonal depression, which the name is kind of self-explanatory. It's seasonal, primarily in the wintertime. Lack of sunlight can contribute to the depression. Usually it's accompanied by decreased social interaction, weight gain, just things that are associated with maybe not being able to go outside. And then there's bipolar disorder. Now, bipolar disorder is different from depression, but it is involved with that list just because of the severe mood swings, the high euphoric, and the extreme low depressive state. As I said, there's a lot of symptoms. Symptoms vary from person to person. They don't have to be all inclusive. It could be one or all. Symptoms include persistent, sad, or empty feelings, feelings of helplessness or pessimism, irritability, guilt, feelings of worthlessness or hopelessness, a loss of interest with hobbies or just things that you would like to do, possessions that used to be valuable, decreased energy, increased fatigue, moving or speaking slower than normal, and feelings of restlessness. As I said before, difficulty sleeping, difficulty concentrating or making decisions, often oversleeping or not sleeping enough. Also accompanying thoughts of death or suicide. It can also have physical aspects too, such as aches, pains, migraines, cramps, and other similar symptoms. Now, with depression, treatment is usually a combination of medicine accompanied with therapy. There is no quick fix. Oftentimes, antidepressants take time. They take roughly 2 to 4 weeks before there's any noticeable difference in mood change or feeling change. Therapy is often, depending on the level of severity, it can be weekly, bi-weekly, monthly, or bi-monthly. Common types of therapy involved are often problem-solving, goal-oriented, just to kind of take away from the negative thoughts, which would be maybe discussing stress factors and figuring out how to overcome those obstacles. There's also inpatient and outpatient therapy. Again, depending on the level of severity, it might require an inpatient treatment where someone's actually physically committed to the hospital due to extreme suicidal thoughts or them being a harm to themselves or others. And then outpatient would obviously be frequent visits to the hospital or the clinic just for therapy along with the medication. Who is at risk? There are certain individuals that are more at risk than others for depression. People with a family history of depression are more prone. Individuals that experience major traumatic life events or major stress events, so life-changing events such as obviously having a child or the death of a loved one, can cause depression. And also certain types of illnesses, such as cancer or other illnesses that may not be treatable. Really, as I said, depression is an extremely serious mental disorder. Early recognition with depression can help to save lives and help not only the individual but the family or the work environment to cope as well, just so they kind of know what's going on. So again, my goal was to just raise awareness, and I hope that my presentation was informal and that this might help the few of you that do experience depression with a loved one or a coworker.